The White House Coronavirus Task Force met today. We continue to move out on President Trump's directive to slow the spread with mitigation, to advance and expand testing across the country, and to work on the critical supplies that our healthcare workers in our nation needs. Today, the President convened the nation's governors, all of the states and territories, and reiterated to them that with FEMA in the lead, our approach is, our response to the coronavirus in this country is locally executed, healthcare workers, local public health officials. It is state managed, and it is federally supported. We took the opportunity to thank all of the governors across the country, our states and territories, for their incredible leadership and the partnership they've forged with this administration. We were able to confirm that 10 major disaster declarations have been issued, most recently to New Jersey, North Carolina, Florida, Texas, and Illinois. We spoke to them about the importance of the economic recovery legislation that will come before the House of Representatives, we believe, tomorrow midday, and we're grateful for their efforts in working for that unanimous bipartisan vote in the United States Senate last night. In addition to direct payments for American families, the average family of four will receive a direct payment of some $3,400. They'll also receive payroll report. Many of the small businesses, even those restaurants that you just spoke about, will now be able to keep people on the payroll for a period of months, even if the restaurant or the business is not open. With the governors, though, we talked about the $150 billion in direct aid to the states, $100 billion in direct assistance to hospitals, and of course the expansion of unemployment benefits to make sure that our states have the resources to meet the challenges that were so evident in those unemployment numbers this morning. On the subject of testing, pleased to report the testing is available in all 50 states. And in partnership with commercial labs across America, this morning we received word that 552,000 tests have been performed and completed all across the United States. We want to thank the American Hospital Association and hospitals across the country that are just now beginning to report in a fulsome way the results of those tests. And when the President signs the law tomorrow, it'll actually be required by law. But as Dr. Birx and Dr. Fauci have explained many times at this podium, it's so important that any hospital or any lab that's doing testing report back to the CDC and FEMA so we have full visibility to provide the President with the very best counsel. Good news today on testing. Abbott Laboratories submitted to the FDA today a request for approval of a point-of-care test. This would be the kind of test where you could go to your doctor. You could get the test done there at your doctor and have the results in no more than 15 minutes. Dr. Steve Hahn will be here tomorrow to talk about progress in evaluating Abbott Laboratories' point-of-care test. Also, speaking of the FDA, on the subject of swabs, the FDA did announce earlier this week that testing symptomatic patients by swabbing from the front of the nose is perfectly appropriate, and it's already begun across the country. It allows for self-collection, and it also relieves the burden on healthcare protection. It saves personal protective equipment from being expended when people can administer a test themselves. And Dr. Birx will speak about the importance and the availability of swabs. With regard to supplies, you heard the President speak about what we have already shipped out from the National Strategic Stockpile. More than 9 million N95 masks for healthcare workers, 20 million surgical masks, 6,000 ventilators, and millions of gloves and gowns and face shields. In addition to that, we are working with a number of suppliers to manufacture ventilators, even while we work with state leaders to assess not just what ventilators are available in their state hospitals, but what ventilators are available in private hospitals across their state. And governors across the country are doing great work evaluating the full supply of tens of thousands of ventilators that are available. Let me also say thank you to the American Society of Anesthesiologists and Dr. Mary Peterson. The American Society of Anesthesiologists actually produced a video. Tomorrow they will host a webinar for healthcare workers to demonstrate how the devices that anesthesiologists use can be very easily converted into a ventilator that's appropriate for a patient struggling with respiratory ailment like the coronavirus. And we're very grateful. This actually adds tens of thousands of devices to the supply, and we're all truly grateful to Dr. Peterson and the whole association for their full cooperation. With 5 of 10 counties in the country being the top counties for coronavirus being in the New York City metropolitan area, let us reiterate our recommendation that any resident of the greater New York City area who has traveled elsewhere in the United States, please check your temperature, mind your health, and self-isolate for 14 days. What we don't want, again, with 5 of the top 10 counties for coronavirus being in the greater New York City area, we don't want anyone, and no one would want to, inadvertently carry the coronavirus to a community or to a family member inadvertently because they've come out of that community. So again, as Dr. Fauci said recently, if you've come out of New York over the last several weeks, before the mitigation measures are put into effect in particular, check your temperature, mind your health, and self-isolate for 14 days. It is inspiring as I prepare to introduce Dr. Birx to talk about the data that we're monitoring on a regular basis, and Dr. Fauci to talk about mitigation. Let me conclude by saying how inspiring it is to see the way America and the American people are responding to this moment. We all were awakened this morning with record unemployment numbers, not unexpected during the time of national crisis that we are facing. But what you may not know is that while there were some 3 million plus new unemployment claims, Walmart announced they're hiring 150,000 new associates through the end of May. Amazon, a few weeks back, announced they're hiring 100,000 additional warehouse employees to meet a growing demand at Amazon for online purchases. CVS Health is going to provide bonuses to their employees working with patients and hire 50,000 workers. And Pizza Hut, I'm told, is planning to hire more than 30,000 permanent employees. And that's just a short summary of a list that totals almost 500,000 jobs that have been announced by businesses around America. And it's not just been about jobs, it's been about generosity. Anheuser-Busch is making a $5 million donation to the American Red Cross to support first responders. OYO Hotels is offering doctors, nurses, and first responders free rooms at any of their 300 hotels all across America. And the pharmaceutical company, AbbVie, is actually donating $25 million to the International Medical Corps and to Feeding America. American businesses are stepping up to partner with us to meet this moment, but they're being incredibly generous as well to all of those that are stepping in the lead and providing healthcare services and, of course, to those most in need. We can do this, America, but it'll take all of us. As the President often says, we're all in this together. But as millions of Americans do their part, with 15 days to slow the spread, putting into practice the President's guidelines for combating the coronavirus and its spread, we grow more confident every day that this too shall pass with the cooperation and generosity and prayers of the American people. I just know that we will slow the spread, we will protect our most vulnerable, and we will heal our land. And now for information on the latest on data and what we're seeing, Dr. Deborah Birx.